And welcome by Brad's Furniture and Appliances. I'm Jordan Prentice, and today I am joined by Viva Swanson of Northern Health, and she is going to tell us about a new daycare pilot program that is underway, specifically tailored to healthcare workers, correct?
Yeah, absolutely.
Okay, thank you so much for joining me today, Viva. Before we get started talking about the program, can you just tell me a little bit about what your specific position at Northern Health is?
Okay, absolutely. So currently I'm the Northeast Leadership Development Advisor, but many in the community will remember me as a maternity nurse. I've been here for 29 years and super excited about this current project. We were funded by the Ministry of Health to look at opportunities for retention of healthcare providers, and for many nurses and healthcare providers in the community and moms and dads, we struggle to find daycare and childcare for extended hours because we generally work 12-hour shifts, 7 to 7, days and nights, and those hours aren't mainstream. So a lot of the childcare providers in the community, whether not-for-profit or for-profit agencies, generally customize their provision of care for 8 to 4, 9 to 5 workers versus a rotating staff worker.
Okay, so tell me, why, I mean, you kind of just explained a little bit, but why, how important is it to have extended daycare for healthcare workers?
Hey, I mean, we all know we need healthcare providers, and we all know that those healthcare providers are mommies and daddies, and families come first. So if we're in a position of not being able to secure safe quality care for our children, we may choose to be a single income family and moms or dads staying home with their babies, which means that we have less care providers in the community for the people we serve. So having partnered with the YMCA in this particular case has been absolutely incredible. Recognizing that YMCA Canada is actually working and looking at our project because they've never done anything like this ever in Canada. So we're doing something totally different. One, we're doing an extended day, so it starts as early as 6:30 in the morning, goes all the way through till 7:30 at night, so that covers the staff working from 7 to 7. It also allows for rotating staff workers to pay for what they use. For a lot of other agencies, you have to pay for full-time use to preserve your space so that when you work 3 days this week and 4 days next week and no days the next week, you know you have continuous care. In this particular model, it's accommodating people that don't work the same days of the week every week, and you only pay for what you use. The extra bonus is because it's not clean in terms of filling all of the spaces 100% of the time because staff are rotating. Those vacant spots are shared with our staffing department so that if somebody's able to pick up a casual shift or a sick call, if they're registered with the program, they can use a space that wouldn't otherwise be used. And then they can pick up a shift at the hospital or where they happen to work if they were a shift worker.
Okay, so I guess that's what falls under scheduling flexibility, right?
Yeah.
And the payment scheme. I wonder, I don't know if you'll have the answer to this, but this just kind of like came into my head. Like, the provincial government or the federal government provide daycare, childcare supports for parents.
Yeah.
Would those supports still be can they use them
They're
towards
still applicable. So
still applicable.
Every family who registers for childcare, regardless of the program, if they qualify for childcare affordability benefits or other benefits, for instance, if you're Treaty 8, you may fall into a different funding program, and every family is able to apply for any of the affordability fundings grants that they are applicable to. That goes towards their payment for childcare, but we are also, our staff are being subsidized as well through this program to ensure that it is affordable as well. So the actual program isn't a $10 a day program under the Ministry of Education and Childcare, but under the prototypical project with the Ministry of Health, we've been able to secure our staff paying no more than $10 a day for each of their children.
Oh, that's amazing.
It is amazing.
Oh my gosh. Okay, so the daycare itself is at Robert Ogilvie Elementary. 2 questions. When did it start? like officially start, and how's it going?
Well, we officially started on the 13th of March,
Okay.
and we have early child years. So we have the infant toddler age group as well as 3 to 5, and then the school age before and after school, and then the summer programs. So it's been a slow start in that it's much more complex and complicated than a normal daycare where you buy full-time space and you just use the days that you use
Right.
the whole thing. The scheduling is a little more complex, getting rotations to match with the availability of childcare. So it's been a little bit slow, but we have filled up our infant toddler, and we have almost all of our 3 to 5s filled. Like I said, any of the spaces that are extra, we're able to fill with casuals or part-timers that can match their pickup schedules to what the childcare availability is if they're registered with the program. The school age has gone a little bit slower. We recognize that it's not unusual with a March start and opening of the program. Most school age kids are probably already taken care of with whatever childcare was organized when they started school in September. And so the uptake's been a little bit slow. But our partners said that's not to be unexpected, because generally there's a little bit of a pickup at the end of the school year planning for September, and then again in August for September. So we're looking at the popularity gaining now that staff are getting much more aware that there's summer programming, and then we will have before and after school care in September. And we are trying to troubleshoot any of the challenges in real time, recognizing it's never been done before. So it's really cool.
I think it's great.
It is. And like I was telling you earlier, I said I have 3 boys, and I spent a lot of time on my maternity leaves, all 3 of them worried about who was going to take care of my babies, and I had the good fortune of...
Sorry. Oh, that's okay. You're right.
The good fortune of being able to secure incredible childcare for my boys.
Yeah.
And so this has been a passion project for me. And my baby turns 21 in a couple of weeks, so it is a lovely way to start, like ramp down in my career with the success of projects like this. And it is going to be such an epic success that they're going to say 10 years from now, remember when they started that pilot project in Fort St. John?
Yeah.
And healthcare providers across the country are going to have childcare.
I think that's
what
amazing.
I
mean,
so,
congratulations on that, Viva. I'm so excited for you. And I mean, you kind of just answered a little bit, but let's talk more specifically here in Fort St. John. What do you hope the lasting impact of this project is on healthcare workers and healthcare in general here?
One, that we keep the healthcare providers we have, and that our staff that go off to have more babies will come back to work after the next baby, because they'll be able to secure safe, quality childcare, and also to recruit new recruits to the area, because we have something to offer that they might not find in other communities. And happier staff, because they'll be happier moms and dads knowing that their kids are being taken care of in a beautiful environment with highly qualified childcare providers. So I think it's all good. I think that when we're looking at recruitment and retention of our healthcare providers, that we always have to recognize our own personal families come first, and our strategies have to be a little further upstream in terms of looking at work-life balance in order to retain our staff.
Of course. Well, I think that's amazing, Viva, and I'm really excited for you, and I hope that you continue to see success in this project. We've been talking with Viva Swanson of Northern Health. She's been telling us about a new pilot daycare project here in Fort St. John, specific for healthcare workers. Thank you so much for joining me today,
having me.
Of course. You have been watching Community Roundup, brought to you by Brad's Furniture and Appliances, and we will see you next time.